up here in Snohomish County. I'm going to pass it off here to Mr. Dave Tyner. He's going to give a quick overview of Dechinger McIntosh, and then pass it off to Anita, who will walk us through the Affordable Care Act and let us know how it will affect small and medium-sized businesses in the Northwest over the next few years.
All right. Well, thank you, John, and welcome to everyone. My name is Dave Tyner, and I'm the Senior Associate here at Dechinger McIntosh, a full-service commercial and personal lines insurance brokerage firm established in the early 60s. I'm here with Anita Condell, the Employee Benefits Manager at DMA, and we are very pleased to review with you today critical elements of the Healthcare Reform or Affordable Care Act, as it's called, and how it might impact your business. The agenda today is as follows. We'll go through with you the enrollment requirements, individual coverage, employer-sponsored plans, tax penalties for individuals and employers, benefit requirements under the ACA mandated health plan changes and essential benefits, employer reporting requirements, ACA taxes and fees, additional tax, and small business tax credits. Now, we'd like you to know that Anita and I are available not only today, but in the future to work with you on any questions or any needs that you might have relating to employee benefits, in particular in the area of medical insurance and health care. At this time, I'd like to now turn the program over to Anita Condell, our Employee Benefits Manager. Anita?
Thank you, David. For today's meeting, we're going to do an overview of healthcare reform for 2014 and moving forward, and the impacts it will have on individuals and employers, small business to large business. Throughout this seminar, should you have questions, feel free to ask your questions in the chat box of the seminar, and we will answer all those questions at the end. And if you cannot hear us, you need us to speak up, please write that as well. So to begin with, effective January 1st, 2014, all applicable individuals must maintain minimum essential coverage for themselves and their dependents. Now, within this slideshow, there will be a definition of what is minimum essential coverage, along with other definitions throughout the slideshow. But an applicable individual who fails to meet the minimum essential coverage will be required to pay a penalty on their tax return. A person is an applicable individual unless one of the following circumstances apply. They have been approved for a religious exemption under the Patient Protection Act. A person is a member of a healthcare sharing ministry or a church trust. A person is not a citizen of the United States or is incarcerated. So if an individual is one of the four, then if they are not one of the four, then they must have the health insurance. Otherwise, there will be tax penalties. And let's see, the minimum essential coverage that an individual must have: coverage under an eligible employer-sponsored health plan. So an individual must have coverage. They have to follow. Oops. Sorry about that.
Is it this one?
Yes. So to qualify for minimal essential coverage, an individual would have coverage through their employer, an employer-sponsored health plan, coverage under an employer-sponsored retiree plan, coverage under certain governmental programs such as Medicare, Medicaid, and the Children's Health Insurance Program and TRICARE, coverage in the individual market, including private insurance on the individual side or your state exchange or federal exchange, and other coverage recognized by the Department of Health and Human Services, including self-funded student health coverage and other coverage under Medicare Advantage plans. So this is the definition of minimum essential coverage that each individual must have for 2014, otherwise be faced a penalty. Now, certain employers must obtain health insurance that is affordable and provides minimum value benefits to their full-time employees and dependent children up to age 26, or the employer will be subject to penalties. Further in the slideshow, there will be a definition of the affordable, minimum value, and what is a full-time employee. This requirement applies to employers with 50 or more full-time employees or full-time equivalents, and will be phased in during 2015 and 16 based on the employer's size. Employees who work 30 or more hours a week are considered full-time, and the chart below will help show and explain what mandates an employer will have to follow depending on the size of their group. So employers who have 1 to 49 full-time employees, they are not required in 2015 or 2016 to offer health benefits to their employees. But if they do offer health benefits, there are specific mandates that they must follow. Those mandates are later in this slide. So if you do offer employee benefits to your employees in 2015 or 16, groups 1 to 49 full-time employees, there are other mandates that you must follow. Groups with 50 to 99 full-time employees are not going to be required to offer health benefits in 2015, but they will be required in 2016. Now again, in 2015, any employer with 50 to 99 employees, if they do offer the health benefits, there are specific regulations that they must follow. In 2016, an employer must offer coverage to at least 95% of their full-time employees and dependents to age 26. For employers of 100 or more full-time employees, in 2015, an employer must offer coverage to 70% of the full-time employees and dependent children to age 26. In 2016, that increases to 95% of full-time employees and dependent children to age 26. Now, the way that you calculate a full-time employee, the calculation is based on the prior calendar year. A full-time employee are those who worked an average of 30 hours or more per week for more than 120 days in a year. Part-time employees are those employees who worked on average less than 30 hours a week for more than 120 days in a year. You calculate the total number of full-time employees, add all the hours of the part-time employees in a week, divide that amount by 30. The sum of the full-time employees and the full-time equivalents is the number used to determine the size of your employer. This is very important because if you are a large employer, but maybe right now you only have 15 employees on your health plan, you will have to follow specific requirements for large employers per the previous slide. Now, the last bullet here, this is a full-time equivalent calculator. So you may click on that, enter your criteria for your business, and this will tell you how many full-time or full-time equivalent employees you have and let you know if you are considered a small employer or a large employer. Affordable coverage for an employer. Coverage is considered affordable if the employee contributions for the employee-only coverage does not exceed 9.5% of an employee's household income. So there are three methods of determining what is affordable. So the 9.5% of an employee's wages, W-2 wages, not reduced for salary reductions under a 401k plan or cafeteria plan, 9.5% of an employee's monthly wages, their hourly rate times 130 hours per month, or 9.5% of the federal poverty level for a single individual. So if an employer were to offer health benefits to their employees, the plan has to be affordable to the employees. And again, to make that plan affordable, the employee's portion of the premium cannot exceed 9.5% of their household income. A plan must provide minimum value if it pays at least 60% of the cost of covered services. Deductibles, co-pays, co-insurance. So if an employee has to have surgeries in the hospital, the plan must pay a minimum of 60%. Okay. A plan must pay a minimum of 60% for it to be considered a minimum value plan. The Department of Health and Human Services has developed a minimum value calculator that can be used to determine if a plan provides minimum value benefits. Now, the last bullet point here, there is also a minimum value calculator where you can click on that. You can enter your specific plan criteria, and this will tell you if your plan that you're offering your employees meets the minimum value criteria. If not, you could be subject to specific tax penalties. Now, tax penalties for individuals, that begins in 2014. So if an applicable individual does not maintain the minimum essential coverage, which was discussed on the previous slides, for 1 or more months during a tax year, then he or she must pay a penalty. The penalty is prorated by the number of months without coverage, and the penalty will increase annually as follows. And again, this is for individuals purchasing coverage on their own, not individuals who have coverage through their employer. In 2014, the penalty will be the greater of $95 per person to a maximum of 3 times that amount for a family, or 1% of their household income. In 2015, that penalty will increase to the greater of $325 per person to a maximum of 3 times that amount for a family, or 2% of their household income. In 2016, it'll increase again to $695 per person to a maximum of 3 times for a family, or 2.5% of the household income. Moving forward in 2017, the penalties will be increased by the cost of living adjustment. Now, tax penalties for employers. In 2015, because employers with 100 plus full-time employees must offer benefits, in 2016 this will apply to employers with 50 or more full-time employees. They're going to ask themselves, do we currently offer our coverage? No. If you don't offer employee benefit coverage, then to the right there's the penalty. It's a penalty of $2,000 per full-time employee minus the first 30 full-time employees. Now let me make a note to you. For the first year in 2015, the first 80 employees are going to be waived. So the penalty of $2,000 per full-time employee minus the first 80 employees for the first year. That's noted at the bottom of the slide. And this fee, this penalty will apply if one full-time employee receives a federal premium subsidy. Now, if you do offer coverage, go down to the next box and you have to ask yourself, does this plan provide minimum value coverage? Again, the minimum value definition is, does this plan cover 60% of the total allowed cost? If the answer is no, then the penalty will be the lesser of $3,000 per full-time employee receiving a subsidy, or $2,000 per full-time employee minus the first 30 full-time employees. If the answer is yes and your plan does provide minimum value coverage, down at the next box, is this coverage affordable to my employees? Are the employees paying less than 9.5% of their income for the employee-only premium? If the answer is no, then the penalty to the right, the lesser of $3,000 per full-time employee receiving a subsidy, or $2,000 per full-time employee minus the first 30 employees. If the answer is yes, then there's no penalty and the employer meets the criteria and will not have any tax penalties. Again, this applies to employers with 100 plus full-time employees next year, 2015, and 50 plus full-time employees in 2016. Now, as we stated previously, should you be an employer who offers benefits now or in 2015, 2016, moving forward, a small employer is 1 to 49 full-time employees, there are specific mandates and plan changes that are required. So for any employer that has 1 to 49 full-time employees who will be offering benefits, some of the changes with the healthcare reform mandates would be guarantee issue and renewability. What this means is the health plans can no longer put a pre-existing condition exclusion on your employee benefits. Also, adjusted community rating. This means this prohibits the rates to increase based on claim history. The inclusion of the 10 essential benefits. The 10 essential benefits will be discussed on the next slide. Out-of-pocket maximums will be capped at $6,350 for an individual or $12,700 for a family. No lifetime limits. That was excluded in 2011. And no annual limits, which was excluded this year, 2014. Waiting periods can no longer exceed 90 days. So for new employees, new hires, waiting periods can no longer exceed 90 days. This will be determined by the specific insurance company in your area. The federal mandate is 90 days, but certain carriers will not allow you to exceed 60 days. Employer-sponsored wellness incentives up to 30% savings. So employers may get up to a 30% discount for wellness. And again, this is for employers of 1 to 49 full-time employees should you offer benefits. Now, the mandates for large group plans, 50 and above full-time employees, very similar. Guarantee issue again and renewability, which again means no pre-existing condition exclusion. If the 10 essential benefits are offered, which are not required, there can be no annual or lifetime limits. So for groups 50 and above, it is not required that they offer the 10 essential benefits. But if they do offer those benefits in their health plan, there can be no annual or lifetime limit on those specific benefits. And we'll discuss that on the next slide. Out-of-pocket annual maximums will be capped at $6,350 for an individual and $12,700 for a family. No lifetime limits and no annual limits. Again, waiting periods can no longer exceed 90 days, subject to differ depending upon your insurance carrier. And the employer-sponsored wellness incentives up to 30% savings. So these are some of the mandated health plan changes for both small and large group that are in effect now and moving forward. The 10 essential benefits, employers with 1 to 49 full-time employees, should you offer health benefits, these 10 essential benefits are required in your benefit package. Now, employers with 50 or more full-time employees are not required to add or cover the essential health benefits, but if they do, there can be no annual or lifetime limits. And these 10 essential benefits include ambulatory patient services, such as doctor visits, outpatient services, emergency services, hospitalization, maternity and newborn care, mental health and substance abuse treatment, including behavioral health, prescription drug coverage, rehabilitative and habilitative services and devices, which include devices and services to help people with injuries, disabilities, or chronic conditions to gain or recover mental and physical skills, laboratory services, preventive and wellness services and chronic disease management, along with pediatric services up to age 19, including dental and vision. And again, there cannot be any lifetime or annual limits on these 10 benefits, whether you are an employer with 1 to 49 full-time employees or 50 and above, and you offer these benefits in your package. Now, there's also employer reporting and notifications. Employers that do offer employee benefits, they are subject to provide what is called a summary of benefits and coverage summary to all their employees. This is for all employer sizes. Employers are required to give participants a uniform summary of benefits and coverage, and the summary of benefits must include standard definitions of medical and health coverage terms, description of the coverage and any cost-sharing requirements such as a deductible or maybe a copay, information regarding coverage limitations or exceptions. This would be maybe a chiropractic or acupuncture. If there is a specific 10-visit limit per calendar year, it must state that. Coverage examples, which illustrate sample medical situations and describe how much coverage a plan would provide in such an event of either having a baby, managing type 2 diabetes, etc. All of the plan summaries must look identical and provide the same information. There is a sample SBC. If you click on the last bullet point, there will be a sample of what an SBC looks like and what is required to be given to each individual on the health plan. In addition, there are exchange notices that all employer sizes must provide to their current and new employees. An exchange notice must be given to any new hire within 14 days of employment with information about the health insurance exchange for your state. So this employer notice, it's just saying in your state we do offer a specific health insurance exchange. You can go to this website. There are two separate models. One model is for employers who do offer health insurance, and the other model notice is for employers that do not offer health insurance. Within the slides, there are links to each notice that you can use as a reference, but these notices are required, again, for new employees within 14 days of employment and permanently. The other reporting and notification requirement, this is going to pertain to employers who file 250 or more W-2s. So this is the W-2 reporting section. Any employer who files over 250 W-2s must report the cost of health coverage provided to each employee annually by January 31st of each year. There is, on the last bullet point, W-2 reporting, some guidelines and additional information from the IRS website. And again, for now, this is only for employers who are filing 250 or more W-2s, subject to change in the future. This is not taxable income to the employee. But again, for further information and more detail, click on the W-2 reporting link, and that will get you to the IRS website. There are also some ACA taxes and fees that will be applied. In short, any insurer or employer and health plans will be required to pay 3 new fees intended to help fund the implementation of the Affordable Care Act. Now, the first one, the PCORI fee, the Patient-Centered Outcomes Research Institute fee, employers, now these fees are built into the employee premiums. Now, this research fee will promote and evaluate and compare health outcomes and clinical effectiveness. So this really is about research on how specific services will benefit or harm individuals. The fee is $1 per member per year for policy plans ending before October 1, 2013, and is increased to $2 thereafter. Future amounts will be indexed to the national health expenditures, and these fees are tax deductible as an ordinary and necessary business expense. These fees are going to, I believe, be for about 7 years until 2019. These fees will be in effect. And again, they are tax deductible as an ordinary and necessary business expense and built into the employee premiums. The permanent insurer fee is an annual tax to help fund premium subsidies for certain individuals and families purchasing coverage through the health insurance exchange. So all employers are going to have to pay this insurer fee, And this is just to help subsidize the individuals who are receiving subsidies on their individual exchanges. It's estimated to be about 2% to 2.5% of the premium in 2014, increasing to 3% or 4% of the premium in future years. This is tax deductible for employers as part of the premium cost. And this fee is a permanent fee. The transitional reassurance tax. This is an annual tax starting this year in January till 2016. This is to help stabilize premiums and the cost of high-risk individuals entering the individual marketplace. In short, this is for individuals who maybe didn't have health insurance previously that are now enrolling and utilizing the benefits. This is going to help stabilize the premium and the cost for everybody involved. The projected cost is approximately $5.25 per member per month in 2014, which then decreases each year for the subsequent 2 years. So this is a 2-year transitional tax. And again, this is applied to all employers who offer health benefits. In 2018, there will be an additional tax called the Cadillac tax. This tax is going to be about 40% of tax on employers that provide high-cost health benefits to their employees. The cost includes the total premiums paid by both the employers and the employee, but not cost-sharing amounts such as deductibles and co-pays on care is received. The 2018 threshold for high-cost plans are $10,200 for an individual or $27,500 for a family. For pre-retirees and individuals in high-risk professions, in 2018, the amounts are going to increase. Now, as an example of this is if an employer offers a very rich benefit plan, maybe a $250 deductible, and the premiums are extremely expensive because the plan is so rich. If an individual's premium is over that threshold of $10,200 for an individual, and let's use $12,200 as an example, it's over by $2,000, then that is going to equal a 40%, it's going to be taxed, that $2,000 will be taxed at 40% or $800. So any employer that is offering a Cadillac plan in 2018 will be taxed at 40% of the premium. Now there's also going to be small business tax credits. The following criteria qualifies an employer for tax credits. For small business to receive these credits, an employer must have fewer than 25 full-time equivalent employees, pay an average wage of less than $50,000 per year, and pay a minimum of 50% of the employee-only premium. If a small business meets these requirements and criteria, they are eligible for the tax credit. Next page. The maximum tax credit for the small employer will increase to 50% of the premiums paid annually from currently 35%, and 35% of premium paid annually for tax-exempt employers, which is currently 25%. To be eligible for the credit, a small employer must pay premiums on behalf of the employees enrolled in a qualified health plan. And again, the qualified health plan has to meet the minimum essential benefits and the other criteria in the previous screens. The credit will be available to employers for 2 consecutive taxable years. Now, in recap for healthcare reform for 2014, businesses 1 to 49 employees are not going to be required to offer benefits in 2015 or 16 and moving forward at this time. But if they are offering benefits, they have to meet the criteria that we previously stated. If you are a larger employer, 50 and above or 100 and above, depending on the tax year, you will be required to offer benefits, and these benefits will have to meet specific mandates. Individuals are required to have insurance starting 2014 or be taxed from 2014 on. And please keep in mind that many of these regulations change on a monthly basis. So some of the regulations that may have been in effect a couple of months ago have now been postponed. And we try to keep up to date as possible. So if things could change in the next month or two, additional mandates could be implemented. Some of these mandates could be taken out, but we will keep you as up to date as possible. Now I'm going to turn this over to Dave for some closing remarks, but please enter or type in any questions in the chat box so we can answer some questions that you may have.
Thank you, Anita, for that excellent overview of the Affordable Care Act and its impact on small and large businesses and their employees. I'd like to thank everyone who tuned in today to get informed on this very important Affordable Care Act, and also to remind you that Anita and I are available to take your calls beyond today for any questions or assistance you might need at your medical benefits or employee benefits program. So at this time, we'd like to go down to the chat area, and let's take questions and let us know if there's anything that you need additional information on.
Okay, go ahead.
Anita and I would like to inform everyone that you will get a copy of the program emailed to you. So all participants today will get an email copy of this presentation.
And should you have questions like Dave had mentioned on your specific business in general, you can always contact by phone or email Dave or myself, and we can give you more detailed information about your specific company. Again, within the slideshow, when you do get it emailed to you, there are specific links and additional documents. What is the full-time equivalent, the calculator there, the specific benefit, does your current plan meet the minimum required benefits? There's a calculator there for you to use. Some good resources, some IRS links on W-2 reporting. So we'll get you this slide today.
Will the links be live for the forms and the web links? Yes,
there's a question about will the links and the forms that I've spoken about be live. Yes, once you receive this slideshow presentation, there are hyperlinks to everything we talked about and the specific forms, including the sample summary of benefits, the notification that you must give your employees within 14 days of hire. All of those links and that information is hyperlinked in the slideshow, and once you click on that, it'll direct you to the appropriate form or website.
Certificate for the training. So there's a question about whether or not a certificate will be issued for training today. I will defer to Suzanne Lamb. I'm not sure what precedent is for webinar certifications. It's something we can look into, but again, I would defer to Suzanne on that. I don't know if she wants to weigh in now, or we might have to get back to you on that offline. Okay, Suzanne says currently we do not offer certifications on the webinar. Do you guys do any sort of certifications?
No, we're not authorized to provide certificates in this connection.
And again, this is a general overview of the healthcare reform for 2014 and moving forward. Any specific questions towards your business, feel free to contact Dave or myself.
Dave, do you want to talk about any other service areas you guys provide that they are interested, just other insurance opportunities?
In closing, we'd like to again reiterate that Deginger McIntosh is a full-service brokerage firm offering all forms of liability insurance, including general liability, professional liability, and miscellaneous liability coverage, property coverages, personal lines, surety bonding, including performance and payment bonds, fiduciary bonds, and so forth, employee benefits, which span the range of medical benefits to pension, 401k related opportunities for you and your employees. Also the HR 360 newsletter and information that provides ongoing updated facts that keep you current and keep you out of trouble. That we can also provide that to you. So please do give us a call. Myself or Nita will be very happy to help you. Any question you might have, we'll be happy to attend to.
And closing off for PNDC, again, this is John DeGiro. We're thrilled to have you all join us today, and hope that you check out some of our other upcoming events. Our big annual event of the year, the Defense Symposium, takes place at the end of the month, 2 weeks from today, in fact, May 28th, down at Joint Base Lewis McChord. So that'll be an opportunity to really get the latest, greatest on defense industry budget and opportunities. Any other questions can be directed straight to Deginger McIntosh and Associates, but PNDC is also here to support you in whatever challenges and opportunities you face in growing your business. Thank you, and have a wonderful day.